Dr. Kuchipudi, thank you so much for taking the time to speak to me. You've been working on a COVID-19 vaccine research at Penn State University. Would you be able to tell me more about this and what the focus of the research has been?
Sure. So first of all, thanks, Nishan, for having me.
Thank you.
I'm a professor at Penn State University, and my research lab focuses on study of zoonotic and emerging viruses. And especially, we focus on RNA viruses. This group includes some of the most critical public health threats like influenza and Zika virus and so on. So after COVID-19 pandemic emerged, so we, along with many other scientists across the world, have started working with the virus. So currently, the research in my lab has multi-focus. So the underpinning question is, if you just take a step back and try and understand where these viruses actually come from. And there is a process called zoonotic spillover. So these viruses, they originally inhabit in animal reservoirs. They jump out of those species and eventually cause human epidemics and pandemics. So a basic question to ask is where this virus came from, and more importantly, what is going to happen? And we already started seeing the spillover of this virus into several animal species like dogs, cats, and minks. So an underpinning question is, what drives this zoonosis or interspecies transmissibility? So in that basic questions, we have a project currently undergoing that really asks this question: what is the potential possibility for this virus, which is currently spreading in people, to eventually or at any point jump into animal species, could be pet animals or livestock species, and could this be a problem? And that is one basic question that we're trying to answer. And from a human health standpoint, there are obviously several challenges. Testing is a challenge, and of course, vaccine is still a challenge. So I'm part of a research group that is developing a novel rapid test to detect SARS coronavirus 2. And from a vaccine standpoint, I'm part of a consortium led by my colleagues across the country. And we are trying to develop a novel platform for COVID vaccine. And this is critical because it is incredible that we already have several vaccines in record time, and already millions of people across the world are being vaccinated. But the story is not over yet. And we need vaccines that could be deployed for any emerging variants of the SARS coronavirus 2 and potentially future emerging coronaviruses. So our research is more of a forward thinking and not for an immediate use to be deployed in the next months. But the research is really to come up with flexible platforms that could put us in a more strong position to respond to emerging variants of this virus and potentially a future emergent coronavirus that might come up at some point in the future.
Doctor, as clinical professor of veterinary, you've previously spoken about the effect of coronavirus on pets and domestic animals. How real is this threat?
Yeah, that's a great question, Nishan. So to keep it simple, currently, we do not believe that this virus is a threat to any animals. So we have no evidence to be concerned that pets could be affected in one way or the other. But that being said, the way all the recorded animal cases, whether it is dogs, cats, or minks, or tigers and lions in the zoo, these were all infections of animals when they were exposed to infected people. So currently, the threat is that infected human beings, if they're in close contact with the susceptible animals that I just mentioned, they could pass on the virus to those animals. So which means that whenever somebody is confirmed or tested positive for COVID, you should take the same precautions as you would do with the other members of your family when you care for your pets. And that is something that we recommend people do. And if you keep distance from your pets and wear mask at home and all those precautions that are being advocated. And with regards to the pet animals, we have no evidence so far to believe that pets are passing the virus from among themselves, or they're passing the virus back to human beings. So from that standpoint, pets are not considered as a threat or a potential source of infection to humans. It's other way around. We are actually putting the pets in danger. if that answers your question.
It does, Doctor. Thank you. Now that India's begun one of the, in fact, the biggest immunization drive in the world, what are your observations about this and what challenges do you think India could face in the months to come?
Yeah, I think what I'm hearing about the vaccination drive is really encouraging, and this is an excellent move by the government of India, and I applaud the drive to do this. But I think one thing that we all have to keep in mind is that the world has never done a vaccination at this scale in such a short span of time, and this is going to be one of those the moments in history that we are setting up towards achieving something that has never been done in the modern history. That being said, producing vaccines and making vaccines is one thing, but the vaccines are only effective if we vaccinate people, when the vaccine is given into people's arms. So the logistics of vaccinating people, and especially if you talk about 1.3 to 1.4 billion people, it is going to be a major challenge. So I am not familiar with the intimate details of how this is being planned, but I think we will all have to wait and see how this pans out. But I think what I do want to say to the viewers of your program, Nishan, is that I do hear several people have some concerns and hesitancy about the vaccines, but I think I just want to make absolutely clear that all the vaccines that are currently approved to use in any part of the world have gone through rigorous scientific and clinical trials. So and that's why I strongly advise and advocate people, if you have the access to the vaccine in your area, please do get vaccinated. And by all people getting vaccinated, and that is the only way we can end this pandemic.
How soon do you foresee the end of this pandemic?
That's an excellent question, Nishan. So I wish I had a crystal ball. And I think if I may turn the question around and they say this is, it all depends on we the people, and it is in our hands how quickly we can end this pandemic. And the reason I say this is that the virus has no special ability or wings, or it can't really spread across the continents, and the virus spreads through people. And this is, I think, people may have gotten bored of listening this over and over again. But unfortunately, this is by far the most important public health advice anybody can give. So how quickly we can end the pandemic also depends on how careful we're going to be in following these precautions. And the reason is that this is an RNA virus, which is inherently capable of mutating, meaning it changes. So the more chance we give the virus to spread between people, the more possibility that the virus would continue to change. So in order to make that process slower or not to happen, if everybody, and that's why the new government in the US has now advocated the 100 days challenge. So from now to 100 days, they're requesting everybody to wear masks. And the concept is pretty simple. It's not rocket science. If every single person wears mask for the next 100 days, we literally stop the virus transmission. And that is the drive that could lead us to end this pandemic soon. So optimistically, we could hope that the pandemic may come to an end later this year. But again, it all depends on all the people across the world and what we are doing and how careful we are and how serious our approach towards protecting us and everybody in our households and neighborhoods.
Thank you, Doctor. This was very informative, and I'm sure that all those who are watching this will have learned a lot from this. Once again, thank you so much for taking the time to speak with me. It's really kind of you.
My pleasure, Nishan. Thank you for having me.